and good. Okay, I have Taylor in the office. She was in an ATV accident about a month ago. So it's something I want to shoot a video on because we get a lot of this, whether it be car accidents, you know, motorcycle, ATV, kids fall off a bike. From accidents like that, quite often your adrenaline's pumping and you may not feel a lot of pain initially, but over time there's a whiplash injury that takes effect and there's scar tissue that builds up, and if you don't get care right away, you can be left way worse off than you normally would have been. So for any car accidents, in her case it was the ATV, anything like that where there's a fall or there's a whiplash effect to the neck and upper back, you want to be seen immediately to get adjusted, to make sure those joints heal properly and in good alignment, so you're not left with a lot of scar tissue and residual problems that can last a lifetime. So for her, it's mainly her neck because she had some whiplash in her mid back. And so that's what we're going to just slide down toward your feet a little bit. Take a nice deep breath in, Taylor. Exhale. Perfect. Perfect. So there's not much to it. That's just a basic thoracic adjustment. She adjusts really well, but that sound you hear is those joints sort of moving through their full range of motion. So we're going to do a little soft tissue work on her shoulders. Lower that for you, Taylor. Okay, so just some tension that builds up from a whiplash injury, like around the shoulders, your trap muscles, which attach way out here to the acromion process of your scapula, run along the superior border of the scapula and attach to your thoracic and cervical spine. So that's where we all hold a lot of tension anyways. This is good for people who are just doing a lot of sitting, computer work, at a desk, way too much on a phone. Don't just take the Motrins and the Advils and just try to numb the pain. That's fine to get you through the day, but to get these problems fixed so they don't become a recurring problem and you're not left with, you know, residual problems like lack of range of motion and chronic pain, chronic headaches, come get adjusted. Get this fixed at the root cause. Go on your back for me, Taylor. Or no, actually stay face down. Let's do this one. Just your arm relax, let it drop down. Good. Same thing right over here. You're good. Deep breath. Exhale all the way down. Nice. Now go on your back for me. I'm gonna adjust her full spine. She's a patient in the office. We're gonna do focusing on her neck. Slide down just a little bit. Have you gotten headaches or is it just a neck pain?
No, I've gotten really bad headaches.
Okay. So she's got a lot of tightness in her neck. And what I mean by that is I'm just feeling the joint play. Not so much how her neck moves globally left and right and side to side, but each individual joint, just trying to slightly motion those joints. And she has a lot of locked restriction in the cervical spine. So just relax your shoulders, contact the worst one and adjust it through its range of motion. Same thing here, Taylor, relax your shoulder. Good. I'm gonna come back to this side. Last one. Way out. Get that hair out of the way. Let your head drop down into my hand. That's the one. Okay, lift your head up for me and relax it back down. Good. So we had to use a little more force than we normally would, which is okay. You're good, right? Mm-hmm. So it was no problem to the patient, but again, we want to break up the restrictions, break up the adhesions, and get the alignment back to the spine so things can heal properly. Okay, go on your side, facing me. So that's basically it for her neck and upper back. She just needs more repetition there. Deep breath. Exhale. Other side, good. Deep breath in, Taylor. Exhale. Good, face down one more time for me. Just gonna recheck everything here in your mid-back. Yeah, feels better. Just kind of rechecking the joint motion. Tighten right through there. Okay, you were all set for today.
All right, thank you.